name's Andrew Browning. I'm a doctor from Australia, although I've been operating on fistula patients here in Tanzania for the last 12 years. Here at Maternity Africa, we've just been having an intensive week of operating, and we've operated on 38 women, with either obstetric fistula or perineal tears in the last week. Each year in Tanzania, there's several hospitals that do this work, and each year about 600 to 800 women get repaired. Here in Maternity Africa, we repair about 200 ladies a year, but the need is great. And every year there's more women that get these injuries during childbirth, and so we are continuing to work. But we know that these injuries are actually preventable. If all women had access to safe care in a hospital to have their baby, and had a delivery with a midwife, or if they needed to have a cesarean to have an operation to have their baby, they wouldn't get fistulas and they wouldn't get perineal tears. But until all women have access to safe obstetric care in Tanzania, we're going to have to continue this work. So anywhere in the world, in Australia where I'm from, or England, or Tanzania, or Ethiopia where I lived for 10 years as well, about 5% of women will get into obstructed labour. Obstructed labour means the baby's head, this is the baby's head, the mother's pelvis. Obstructed labour means it's not fitting out. Either the pelvis is too small or the head's too big, it's getting stuck. So that happens in about 5% of women in labour. If they're in a hospital, that's very quickly diagnosed and they call the doctor, he does a cesarean or an operation to have the baby, and everything's fine. But if you're in a remote area of Tanzania and you can't get to a hospital quickly and you get into obstructed labour, then you stay in labour. So the ladies we have treated this week have been in labour for 3 to 5, sometimes even 7 days. The baby usually dies after that long labour, and then they deliver their dead baby. But they usually start leaking quite quickly from their bladder and their bowel after they deliver their dead baby. Because they've been in labour for so long, the baby's head's pressed against the bones of the pelvis, so all the tissues between the bladder, birth canal, rectum, birth canal are all crushed, the blood supply is cut off, so all those tissues die. So after they deliver their dead baby, all those dead tissues come away and they're left with a big fistula, or a hole between bladder, vagina, rectum, vagina, so they leak urine and faeces continually. Okay. So you prevent it by getting to hospital quickly, having an operation if you need to have your baby, and then you won't get the fistula. Operations are successful. About 80% of women, when we repair the fistula, they're cured. Some are not cured. So we've had a lot of patients here this week who've been operated on 3 times, 4 times in other hospitals, and even here. And their damage was so severe that they can't be operated on. So 2 operations we did this week, the damage was so severe that they couldn't be cured, so we had to put their urine into their bowel because the bladder was no longer treatable, the bladder was all destroyed. So they passed the urine and bowel together, and they're dry like that. The only way to stop fistula from happening is to have all women have their baby in a hospital with someone who can do a cesarean if they need to. So until that happens, then you're still going to get fistulas.